Thank you, Mariah. First Edition begins this half hour learning more about what health experts call the stealth variant, the latest sub-mutation of Omicron. As we have stated, it was first detected in Denmark, making its way to the U.S. Its official name is B1.2. Doctors say the stealth variant spread with more ease than Omicron, but nothing suggests it is more dangerous. At least 2 cases have been detected in the Houston area, but none so far here in the Coastal Bend.
Dr. Salim Surani is going to join us live right now to continue this discussion. Dr. Surani, it's so good to see you. It did not take long for a new variant to make its way into the headlines. Your take on what we're seeing right now, and should we be concerned?
Good morning, John Thomas. Glad to be here. I think those variants will keep on coming in, and virus will keep on having a mutation. If they want to survive, they want to live, they want to make sure that they keep on modifying, become more transmissible, but at the same time, they make sure that it doesn't cause increased mortality or lethality, because if a host died, then the virus dies too. Same thing we see in the flu vaccine, flu viruses a lot. Every year we see a different mutation, and we come with a different series of vaccines. So what this stealth variant is, when the variant came in, Omicron is a Greek term, and what the genomics use the term is a BA1. And now they have a BA2 and BA3. The BA2 has almost 31 of the same mutation as BA1 plus some other mutations. And what it does is it tries to escape some of the routine testing. So sometimes it can evade our testing. In other words, if it evades the testing, then it goes undetected and it can spread more people. Good thing is, so far what we are seeing is that it is not as lethal as Delta. It just acts like Omicron. It doesn't increase the serious illness and hospitalization. But since it evades our testing mechanism, then it can be become more transmissible.
Well, that kind of piggybacks off a question I keep hearing in the community, especially from my family, and one of them, a nurse in particular, who keeps asking, why are people who have been diagnosed with COVID, why is it that people are still testing positive weeks or months later? Are they still contagious even with no symptoms if they're testing positive?
It just depends on that. Even if your immunity takes care of the virus burden, which is enough to spread the infection, but they still can have a very low level of virulence activity, which may not cause any illness or disease. But our tests are so sensitive that if there is even any thing in the air passages there, that we are able to go into strep and pick those things up. And sometimes it can be some broken filaments and proteins which can be picked up, and tests can be positive. So the thing is that if you're not having any symptoms and if you've passed the incubation period, most of the time you're not infectious, and the test can be still positive for a while, especially when the Delta, even the COVID came in initially. We knew that it can be found in the stool for 6, 8, or even up to 3 months.
Okay, Dr. Surani, we always appreciate your insight. Thank you so much for getting up early with us, bright and early here on First Edition. If you have a question for Dr. Surani and you're up right now having a cup of coffee or orange juice and want to know what we're talking about or further questions about this subvariant, send us a text at 361-855-6397. Barbie's going to be talking with Dr. Surani in the next half hour.